So the slide I have up right now is from The Lord of the Rings, and where it's a quote from The Lord of the Rings where Frodo is talking about how he wished it need not have happened in his time. And Gandalf says, so do I. But what we can do is decide what we're going to do about it. What we're talking about today is COVID-19, and it has been officially declared a pandemic. So what we need to be filled in, we need to have information on the medical and pastoral things we need to be worrying about. This image is of the actual virus, and you can see the corona around the viral particles. That's why it's called coronavirus, is because it has little attachments that stick out from the viral particle, and they can attach to your respiratory tract and other parts of your body and make you sick. So this is called severe acute respiratory syndrome coronavirus 2. That's because there was a SARS virus before this, and this is considered a species of it. The disease is called COVID-19. So I'm going to use it somewhat interchangeably, but understand there's a difference when we talk about SARS-CoV-2 and COVID-19. We're talking about the virus and the disease. So I'm Dr. Dave Carsten. I'm an assistant professor at Oregon Health Sciences University. I'm a commissioner for the Department of Health in Washington, and I'm in the infection control chair. I'm a dentist anesthesiologist. I work in hospital dentistry up at Oregon Health Sciences University. I have a background in biochemistry. Before I graduated, I was also working on a degree in medical bacteriology, which I didn't complete, but I got to take most of the upper division courses in bacteriology. And working on a master's degree, I also worked on E. coli and viruses. So I have some background in this. And as I said, I'm chair of infection control. I was also going to be speaking at the annual meeting, we call it OSAP, and that's about safety in the dental environment, but I'm pretty sure that meeting's going to be canceled. I was going to be talking with a person from the CDC, but I don't think they're going to have time. I would also like to give a special thank you to Dr. Laura Jordan. Dr. Jordan is head of family medicine at one of the hospitals in Shanghai, and she was here visiting with family just recently. She's been able to fill me in as well as connect me to some of the practitioners at that Shanghai hospital. So I've been able to talk to some of the people that are dealing with this crisis directly. I also want to thank Dr. Keith Collins for providing some of the technology that's making this possible. And by the way, I'm also a spiritual care volunteer right here. So you can see on the slide here that this is a message from Tana Engdahl, the spiritual leader of the Cowlitz. And you can read it at your leisure. What Tana shared with me, and I asked her if there was anything that I could say. So I separated this piece out. She was mentioning how her people went through a terrible time, and especially back in the 1830s, most of them were exterminated from either disease or mistreatment. And so she well understands a crisis like this. But she also told me that she's unable to see any heartlessness in this situation, and that not even our top health experts really understand how this earthborne contagion works, thrives, and kills. So we know we have no great weapon. When I was coming here today, I was thinking about the Jabberwock, and that talking about that dragon in the woods, and how we really have no Vorpal blade right now. All we can do is hide. And so we'll do our best to hide, whether that means by social distancing, not seeing people we love, trying to do the best we can to make sure that we don't contract this virus. So isolation really is our only weapon currently. So what is the epidemiology? The COVID-19, the R0, they call it in epidemiology, is 2 to 3, meaning that each person that gets infected is probably going to expose 2 or 3 other people. And so hence it spreads. And in fact, it spreads at a exponential rate. The Spanish flu of 1918 also had an R0 of between 2 and 3. If you want to compare pandemics, because that would be the last pandemic that I would refer back to 102 years ago. That's really the last one that was worldwide. And what does pandemic mean? It really just means widespread. Now there is, people have bandied about what does that definition mean, but it seems to be in every country in the world now. So I think it's legitimately a pandemic. Fatality rate of COVID-19. Now, the information we get from China is that it's about 2.5%, but that's based on what happened there. In Korea, however, where they've done extensive testing, hundreds of thousands of tests, testing whole communities, the death rate seems to be much closer to about 0.7%. That should not give you comfort. It's better than 2.5, but that's a big number. Spanish flu, on the other hand, the H1N1, killed between 2 and 10%. We don't really have accurate figures because we don't really have good records from that time. A lot of countries tried to hide what was going on. And of course, that was right near World War I. Treatment and vaccination are likely going to be difficult, as coronas are odd beasts. We tried to do vaccines for both the SARS and MERS, and it was unsuccessful. And that was some time ago. So maybe we're going to be a little more clever this time and figure something out. We'll see. But without intervention, the Spanish flu killed, now, by some estimates, about 50 million people. We estimate also that about 1/3 of the world's population was infected. So in other words, about 500, half a billion people got that Spanish flu. But they didn't know what they were dealing with. They didn't know what was going on, and we do. At the time, the popular treatments were quinine, phenolphthalein, and dry champagne. I can see where dry champagne might have some advantage. None of the other stuff, I think, had much of an effect. So they didn't recognize what caused this until 1940 with the invention of the electron microscope. One of the big concerning things with this, as I said, is the death rate, but the proportion of who dies. So at this point, nobody under the age of 9 has died. Now, that it may be that that is going to be updated, but very few children die. And these are numbers from the article that was published in the Journal of the American Medical Association on the 27th of February from the cases from China, mostly Wuhan, Shanghai, and the surrounding area. What's disturbing is once people cross about the age of 50, then the risk goes up considerably for mortality. By the time people hit about 65, that risk is around 4%. When you hit the decade between 70 and 80, it's about 8%. And beyond 80, it's about 15%, and it continues to increase after that. So how do people deal with the anxiety of having this uncontrollable beast in the woods, this Jabberwock, because we don't have a Vorpal blade? So just this morning, I was looking at what a friend of mine said, and I changed the name. Janet and I think about April 1st that everybody's just going to go say screw it and go back to their daily lives. That's what he believes. On the other hand, I was talking to Dr. David Bloom yesterday, and he said, I'm closing my practice to all elective procedures and focusing on this pandemic. If we quarantine ourselves, we can reduce this death rate from 3.3 to 5% to maybe 1%. We've got to do this. It's our moral obligation. So we are in a pandemic and people are panicking. So anybody know where this is from? Know where your towel is. So long, thanks for all the fish. Don't panic. That's from Hitchhiker's Guide to the Galaxy. Yeah. So what are people doing? I've got a picture here of something that's on the internet right now. It's in a tanker car that says COVID-19. Well, we know that this is fake, but that's one way people deal with anxiety, is they create a narrative. Our brains are wonderful at creating false narratives about why something's happened so that they have a better understanding, or maybe they could have some control of it if they create that false narratives. And of course, here, some people want to make jokes, and that's okay. I mean, we have to lighten up. This is a picture of a T-Rex saying, couldn't wash hands, now extinct. Or on this alcohol hand cleaner that has Tabasco in it. Now, I thought that was clever, because if you do that, you can't touch your face. It'll burn. So I thought, gosh, that'd be clever. I wonder if somebody would make that. But here's a picture of Trader Joe's a couple of days ago with the shelves empty because people are afraid. They don't know what's coming. So this gives them something that they can act on, something they can physically do to help relieve some of that anxiety, to believe that they have some level of control in their lives. Or here is a roll of toilet paper with each piece of paper marked with a day of the week. Because people are buying all the toilet paper, and it's hard to find toilet paper right now. And I'm wondering, why are they doing that? I guess they're afraid they won't be able to get out and get toilet paper. Then Father John Ludwig, I don't know if any of you remember him. He was the pastor at Our Lady of Lourdes. He sent me a little note. You know, if you buy 30 rolls of toilet paper, tithing is not canceled. You got to send 3 to the church. And here's a picture of a makeshift bidet where someone took a kitchen sprayer. And I suppose you could do that too. I'm sure the people with bidets are laughing. And this picture is of, well, I'm sure this is not real dentistry being provided, but people trying to do dentistry with poles so they can maintain their social distance. We do need to think about how dentistry, because we create so many splashes and aerosols, in this case, we're really high risk, not low risk.
I saw a chart about in the New York Times, I think yesterday, showing different professions, and the level of risk in dentists was the worst.
Yeah, it's very high because we create splashes and aerosols, and we're in close proximity to people. So me, how do I deal with my anxiety? Information. I got to know everything about it. So I know that this virus spreads best at 8.72 degrees Celsius, which is about 50 degrees Fahrenheit. And it's killed at 56 degrees Celsius for 30 minutes. That's about 133 degrees. I guess I just can't stop myself. Biostatisticians are saying that 2/3, maybe 80% of the world's population will probably get this. Maybe that's, well, you know what? Maybe that isn't so pessimistic. That is a possibility. One of the disturbing things is the rate that this distributes itself 10 times every 19 days. I was glad to see that Dr. Kahani, and I had the pleasure of exchanging some notes with him this past weekend. Dr. Kahani, president of the American Dental Association, has put out a notice that he's asking all dentists take a 3-week hiatus, and let's decide what we're going to do, but we need to stop transmission now. Unfortunately, when we see what's happening, we're looking at a 3-week echo. What we see right now is what happened 3 weeks ago when we're looking at a death in general. Also, I wanted to mention again, Dr. David Bloom, who's closing his practice, which is a huge thing for him, but he's decided he's going to focus on dealing with this virus. And in fact, that's what everybody in healthcare has to consider doing. We really should do it. So why is this thing such a problem? Well, I've got here a graph of on the y-axis, we have deadliness, and on the x-axis, we have contagiousness. And this virus falls right into the Goldilocks zone, where it's just deadly enough to be bad and just contagious enough to be terrible, so that it can infect a lot of people and kill some. But a lot of people don't get that sick, so they can spread it. So it's a perfectly designed, perfectly positioned virus to be a pandemic. Not too deadly, but just deadly enough to be bad. And it's very comparable to some of our favorites like typhoid and tuberculosis, and even Spanish flu, as you saw. And when I was comparing the R naught and the fatality values. So when we look at who gets this, in China, what they were finding is the people between 40 and 69 were mostly the folks that were catching this. So under the age of 9, yeah, they probably do catch it. And the way this graph is distributed, it's really on how many people got visibly sick. It's not showing the people that just got a runny nose, because a lot of these kids get a runny nose but spread the virus. Unfortunately, 1% of people show no symptoms at all and can spread the virus. The disturbing part is, though, the fatality, where it climbs very steeply as people age, especially starting up at about age 50. So that's where we really have to consider, what are we going to do to help protect our elderly neighbors? How we can encourage them to stay put, and that other people will help them, and we've got to minimize contact, which is really horrible in many ways because they're going to be isolated. Dr. Jordan put up a YouTube where she was talking with a psychiatrist and talking about isolation psychosis and how that affects people and how that's particularly bad for elderly. So here I wanted to show what happened on the timeline. So what I'm showing in this slide is that on the 27th of December, the Chinese officially recognized that this thing was happening. The indications are it probably was happening in November and people just didn't know it, or maybe even into October, and they just didn't know it. Well, by the 23rd of January, they were shutting down Wuhan, and then soon after, many of the other major cities in China. And then by 9th of March, they were starting to open things up and come back to normal because they had a strict quarantine, a very strict quarantine, which I think will be very difficult for us to model. And in fact, we're really past the containment period now, and we're really into mitigation. How can we make this not as bad? It's not a matter of prevention. It's how can we mitigate the consequence? So one of the things that I wanted to point out here, and this is a short video, because the Chinese soon realized that their health system would be overwhelmed, and so they were able to build a hospital in 9 days. So you've probably all heard about that, but they soon realized that because of the way this thing was spreading, they would be overwhelmed. So let me pop past that. We don't need to see the full construction of it. It's amazing to see it. Right now in the United States, we have less than 95,000 ICU beds. Less than 95,000. We have perhaps 200,000 ventilators. Now, as you well know, the chaplain sitting in front of me, you know that oftentimes those ICU beds are used. We're going to need those ICU beds. And so what are we going to do? And that 5% of people that need to be hospitalized and put on a ventilator, if we don't have an ICU bed, we're in trouble, or at least they're in trouble. So Danny Jacobs, the president of OHSU, was saying that if we don't take this seriously now, access to needed care will be severely hampered. So when I drove into work yesterday morning, I was noticing how they had taken the exercise facility and they changed it into what looked like a triage unit. And we're in the midst of dumping everything upside down at OHSU because we have to be ready. This is a picture of Laura Jordan, who you can watch her interview on KGW 8. I'm sure you can look it up. And she will talk for about 20 minutes about her experience and what we need to be considering right now. You know, a lot of people, when they look out there and they don't see lots of people sick, they think this is false. Well, this is a slide of the night sky. And what you may not realize is that out in the night sky is the Andromeda Galaxy. You just don't see it there, but it's enormous. If you would hold up your hand and put it up like at arm's distance, that's how big it is. It's there. It's real. It's coming. fact, that's true, it's coming. So what the Italians are facing, and this came out a few days ago, this is the cover of a note that they had to send out, how to triage who to save and who not to, because they're having to triage patients that are desperately ill and which one's more likely to survive and who gets the vent and who doesn't. Because if we could limit the spread and slow it down, maybe we won't overwhelm our healthcare system and we'll be able to put people on the vent that need it. So how can we help people? Well, it goes back to that same model that I've shared with you so many times, that we have to have curiosity about their story. We have to be mindful. We have to have empathy and understand. Our own stuff is going to move us to compassion. That's why you all are here. And then we can act on it however we can, even if it's only calling our neighbor up and talking to them to make sure they're okay. So what about youth? They're frightened. They're not really at risk, but they're frightened. Probably a lot of it is because we're frightened. We're the people at risk, not them so much, but they see it as a risk to themselves. Business owners are threatened. I would say, you know, even in spite of the fact we're talking about 2 or 3 weeks, I think realistically, we're probably looking at more of a 90 days or more. Well, as President Trump said yesterday, he was saying July, August. I'm thinking it may be better than that if we can mediate well, but I just don't know at this point. It really depends upon what actions we're willing to take right now. For medical staff, that's where I think it's really going to hit, is if we get overwhelmed and we're having to make those horrible decisions of who lives and dies when both of them were savable, that's going to be just extremely traumatic. I feel bad for you because you're going to deal with that trauma. Patients with comorbidities, they're in trouble. We've got to minimize the contact for them, and they may not really be willing to acknowledge it. They want to go out, they want to be independent, they want to go to the store, just like they always have, and why can't they? Oh, this is just a bunch of baloney. Because I've heard that from people. They don't understand what the danger really is. Hey, last time something like this was around was 102 years ago. There's pretty much nobody alive from that time anymore, very, very few. People with cancer, autoimmune disease, transplant patients, they're all at risk. People that smoke, people that have COPD. One of the things you'll notice in the Chinese data is that more men than women died. It's probably because of the smoking. And people with COPD are definitely at risk. So as I said, independent elderly, we have to talk to the people we know and explain to them, please stay in. We'll try to get you help. We'll try to make sure you're okay. But let's make sure somebody's checking in regularly. Infirm elderly, who's going to help them? How can we minimize the risk of exposure to them? As we've seen, the nursing homes have been really hit in Seattle. I'm expecting, unless we're very, very careful, that same thing is going to happen here. And the vulnerable disabled, you know, oftentimes the people that I see at OHSU are those folks who are not really cooperative and they don't understand. And you can't really get them to understand. And it's really tough to deal with. Or caregivers, how are we going to help them? That's move. So medical staff in particular, I'd like all of us to think about how we can help them out through this, because I think they're going to be hit more than anyone. Recognize how your own experience, your way of thinking about this is going to affect how you deal with this and how you're going to help other people. Know that feeling stressed, guilty, or angry is common when there's an infectious disease process going on like this. I don't think any of us have ever experienced anything like this. We'd have to look back to what people wrote about from 1918 and how they dealt with it. Connect with others. Talk about and share information, but also Enjoy the time and the relationship. People need to unwind a bit. They need to just be with people and calm down. But also, we need to recommend that we take time to renew our spirits through meditation, prayer, or even feel good about helping other people. So there's lots of false information out. Spray chlorine or alcohol in the skin kills viruses in the body. No, 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 don't do that. Older adults and young people are at risk. Well, it's not exactly. Older people are at risk. Younger people can infect older people. Children cannot catch COVID-19. Oh no, they can. In fact, we think the risk is about even. They just don't suffer very much from it. All age groups can become infected. COVID-19 is just like the flu. It is not just like the flu. The mortality is much higher than the flu. Everyone with COVID-19 dies? Absolutely not. In fact, even if we did nothing and the whole population would be infected, 95% of people would survive. But 5% would die if we do nothing. Cats and dogs spread coronavirus? They don't. Face masks protect against coronavirus? Well, not exactly. So if you're wearing an N95, so I've got some masks here. I've got a couple of N95s. I've got a level 3. An N95 can protect you if you know how to wear it, if you fit it, if it's got a seal, and then if you remove it properly. If you don't remove it properly and you touch the outside of the mask, you're going to be infected. And it just wasted a mask that somebody needs to use. So when if you are going to use a mask, what does it do? Especially if you're not using an N95. And I'm not recommending this to people, but if for some reason you have to use a mask and you're exposed to corona, the outside is going to have corona on it. And if you touch that, you're exposed. So what do you do with a mask? You're going to have to take it off properly, fold it in on itself, fold it over, and put it in medical waste. Otherwise, you've wasted your time using it, and you've wasted a mask that a healthcare provider could use. Hand dryers kill coronavirus. No, they probably spread it. SARS-CoV-2 is just a mutated form of the common cold. No, it is a coronavirus. It's not that closely related. You have to be with someone for 10 minutes. No, you just have to have enough of exposure that you get enough viral particles that you get it. Or maybe you get enough viral particles that you could spread it to someone else. Rinsing the nose with saline protects against coronavirus. No. You can protect yourself by gargling with bleach. No, no, no. Antibiotics kill coronavirus. No, they might kill the secondary infection if somebody gets pneumonia, but they don't kill coronavirus. Thermal scanners can diagnose coronavirus. No. Garlic protects you against coronavirus. Well, there's no evidence, but I'm thinking social distancing, maybe. Parcels from China can spread coronavirus. Well, maybe if it was overnighted, probably not. Home remedies can cure and protect against corona-19. Probably not, at least there's no evidence that they do. Hand washing regimen, however, and avoiding places where there might be sick people, yeah, that helps. You can catch coronavirus from eating Chinese food. No. You can catch coronavirus from urine and feces. Now, wait a minute. Feces do have coronavirus, so it's oral fecal, which means that people have to be even more careful about cleaning their hands. And in fact, that's one of the big problems with little guys, little kids, is they don't clean their hands well enough. And so we have to consider that. The virus will die off when the temperatures rise in the spring. We have no evidence of that. And in fact, if you look at the maps of exposure, you'll see that it's summer in the Southern Hemisphere and they got coronavirus. Coronavirus is the deadliest virus known to man. No, it isn't. Flu and pneumonia vaccines protect against corona? No. The virus originated in a laboratory? I don't think so. The outbreak began because people ate bat soup. Well, frankly, I just don't know. So what should we do? Avoid close contact with people that seem to be at risk for their benefit. Try not to touch your eyes, nose, or mouth. Stay at home if you're sick. That's why Gwen's not here. She was feeling a little under the weather. Sneeze into a tissue, throw it in the trash. and it sneezes into the crook of your elbow. But I want you to think about doing elbow bumps. Don't do that. Touch toes or something like that, because of this oral fecal issue. Know that, you know, there's a fair number of fecal bacteria on floors and on dirt. Think about your shoes. Be careful. When you take your shoes off, don't take them into the house. Clean your hands. Use standard cleaning sprays and wipes to disinfect frequently. Yeah, all kinds of stuff will kill this. Anything that will dissolve a fat will kill this virus. Wash your hands with soap regularly for 20 seconds. Happy birthday to you. And make sure you get your thumbs and all your fingers. Happy birthday. You got to sing it twice. Or come up with another song, or one of the songs that have been invented. Unless you're a healthcare worker or caring for someone, it is not recommended that you use a face mask. Now, in China, you will see that people wear face masks, but understand, they protect other people if everybody wears them. Well, we don't have enough masks. So that's why we recommend you just stay put unless you have to go out. So these tips may seem simplistic, but during a pandemic, these are the best ways to make a difference. So signs of COVID. Fever is the most common one. Way over 90% of people have a fever, but it's fairly low. It can be fairly low grade. So that's why in our triage at OHSU, we're topping it at 37.3 centigrade, 100 degrees Fahrenheit. 100 degrees is where we cut the line. Most people have, not all, most people have a dry cough. Some people can feel achy as though they have the flu. Some people have headaches. The symptoms are variable. The best one we have to go by is, do you have a fever? So signs and symptoms, no particular set of signs and symptoms can reliably discriminate this. So the best thing that can discriminate this is getting the test, where they scrape a little bit or they swab your nose and they do a PCR and then they do a monoclonal antibody and they can identify it, except we don't have the tests. So, we don't have very many, and that makes it a problem. Medium incubation period takes about 4 to 6 days, so people can spill virus for 4 to 6 days without really showing many symptoms. Most people will recover spontaneously without any real help. But the complications are pneumonia and respiratory failure, where they'll have to have a vent. And that's where we have to suppress the spread and spread it out so that we won't overwhelm our ICU. So people have mild or no symptoms. 81% have just kind of mild to flu-y symptoms. 1% no symptoms. About 5% probably will need a ventilator. They're going to be mostly people in their 70s or 80s. They're going to really desperately need it. If we don't have it, we're going to be in that terrible position of deciding who gets it and who doesn't. Viral shedding is greatest when people are symptomatic. We have to keep that in mind. We're going to have some people in the rooms here, and so it's going to be dangerous. So we've got to protect ourselves. We've got to use our PPEs as proper. And if we're not sure about how to use it, we need to get some training. Comorbidity and advanced disease are the highest risks. Cardiovascular disease, diabetes, and COPD, chronic respiratory diseases. Immunocompromised. HIV is definitely at risk. People that are going through transplant therapy, definitely at risk. Pregnancy, on the other hand, we can't see any apparent risk. At this point, the data is very kind of shrugged, not sure. Apparently not. We've seen babies get it. We've seen pregnant women get it, and they seem to be okay. I'm not saying it's okay, but they seem to be okay. So what this is a graph of how you would like to treat a pandemic. And so we're already past the containment phase. And in fact, we're at the point where transmission is outpacing containment, and we're really getting into mitigation, and things are ramping up. So we have to prepare. So recommendations for people with HIV: ensure you have an ample supply of medication. You shouldn't be going out. Keep your vaccinations up to date. I hope you've done it already. Establish a plan for clinical care if you're isolated or quarantined. Telemedicine may be a consideration. Maintain a social network, but remotely. I know people like to be social, but you're going to have to do it via electronics right now to protect yourself and others. Don't panic. Unfortunately, because people want to relieve their anxiety, they've been buying all the alcohol, when actually it's only about 75% as good as soap and water. If you have the option of soap and water, use soap and water. Alcohol is for when you don't have soap and water accessible. Like in this room, where we don't have a sink, we have alcohol. So that's when you use it. These coronaviruses have been around for who knows how long, thousands and thousands of years, but they're coming quicker and quicker. So we've had SARS and we've had MERS here in the last 20 years. People attempted to create vaccines against those, they were unsuccessful. Do we think it came from bats? Well, it's about 97, 98% identical to a bat coronavirus, and it's actually more similar to a civet. We think it was probably exchanged between the two, and that's what caused the transmission to humans. They're zoonotic, but it had to have mutations to be able to infect humans. So what are examples of ineffective infection control? Public toilets have seats that you put paper on. Do you think the paper works? No, it doesn't work. 10 layers wouldn't work. But intact skin is a great barrier. But think about that. Okay, you might get some transmission.
Sorry, but why does paper not work?
Because the water can go right through. That's why they use paper, because it dissolves in water. That's why it doesn't work. So there was a couple of journal articles that were produced to show it doesn't really work. Now, if it's perfectly dry, maybe, but oftentimes it isn't perfectly dry because all kinds of droplets come with the flush. Now, if you clean the seat with alcohol, it probably would be okay. I still would be inclined to use the piece of paper, but realize that every time there's a flush, this stuff blows up into the air and it settles on stuff. And what do you think it settles on? Toilet paper. Grosses me out. So the power of hand dryers, they create aerosols. If people don't wash their hands thoroughly, blows it all around. And too many people don't wash their hands properly. It takes about 30 minutes for the majority of the aerosol to settle, but some of the studies now are saying that this could be floating around for quite a bit longer. It really depends upon the density of the virus, whether it's going to be a problem that if it's floating around still 3 hours later. But each of us has a different innate immunity and how much we can fend this off. And if you have too many virus particles that hit you, you're not going to fend it off, because no one in the world, except the people that have already recovered, are resistant to this. Now, keep in mind, we had measles last year around here. That'll float in the air for 4 hours, but that's so highly infective, you can get it even then. This is not quite that level. Influenza does remain infective for about 30 minutes. So infection control is about stopping transmission from one person to another. So I've got here a chart of how these masks work. Keep in mind that mostly masks that you can get in the public are only going to protect other people. And if the whole crowd wears them, I guess that might work if you maintain social distancing, but mostly they're not going to be very valuable in a public space, unless maybe you're a very sick patient and you've got to go out, and maybe then you have an N95 that has been fitted to you. Now, I know that the State Department of Health has requested masks. I believe that they have been delivered now, but they're going to be distributed as necessary. They asked for 233,000 masks. I think they do have them. People that I work at the State Department of Health have been sorting this stuff in their warehouse there. So I don't know when it's going to be delivered, but I imagine that we are going to have some supplies made available as necessary. So as I said, I'm in a chair of infection control. It's been very frustrating because when you do your job in infection control and people do infections, they don't think you're necessary. So in fact, I've kind of got to imagine that I'm sort of Luke Skywalker with Yoda telling me, transmission, you must stop. Yeah, I've been trying. That's why I keep talking to people. And consult the sacred texts like Learner and Learner, Infectious Disease. But unfortunately, until this came along, people were thinking I was more like Darth Vader. You know, your lack of faith in infection control is disturbing. That's me. Unfortunately, for me, it's frustrating. And I've just been kind of like this poor cow looking out into the ocean, wondering why don't they understand? Infectious diseases are transmitted from person to person by direct or indirect contact. You can get it on objects. Infectious diseases can be transmitted by means of aerosols or droplets. Mostly in this case, it's droplets. Viruses, bacteria, parasites, and fungi are all examples. SARS-CoV-2, along with other infectious diseases, can be transmitted by fluids, aerosols, and skin contact. And as I mentioned, the SARS is in fecal samples. We can detect it there. We're not sure how much that plays a role, but it might well. It can. Frequent hand washing and social distancing are going to reduce disease transmission. Please do that. Barriers like masks and gloves are simple ways to reduce, but not eliminate, transmission. You need to use them judiciously because our healthcare providers need them right now. Proper removal of contaminated PPEs, especially your mask. You've got to be very careful and be conscious, be mindful of when you're removing PPEs. The virus is novel. No humans have immunity to this. Some people will have maybe some innate immunity, but if you get enough viral particles, you will all get it. There are no treatments available, no drugs. Now, you've probably heard about talk of vaccines. Understand what it takes to develop a vaccine. There are 5 different levels. Level 0 trials where they're trying it on animals to see if they can generate an immunity. Now, this is after they generated some. Now, there was a company in Seattle that said they had a vaccine available in 3 hours, but you've got to show that it works. Now, it was unsuccessful with SARS and MERS, but we're trying phase 1 trials right now. So that's usually where you take 45 people, but understand that the vaccines they developed for SARS and MERS never made it past level 1 trials. So we're hoping that we're more clever now. We've had a little bit of time to get more sophisticated. I'm hoping, but normally it takes about 5 to 7 years to create a vaccine that's novel. Now, because we have experience with flu vaccines, we can create those in 18 months, maybe a year. How's this going to help us? So unless somebody comes up with some novel new way, we've got a ways to wait. So really our best opportunity is isolation and keeping this to a low level. Hospitalization is needed when breathing becomes difficult. That's going to be about 5% of people that catch this. One proven method to stop a virus like this is isolation. I think it's going to be difficult to enforce in the US, but maybe not. Maybe people will figure out how to do it. I hope we can pull together to make this happen. I was listening to Greg Poland, MD, head of vaccine research for Mayo Clinic. He's been there for 33 years. He said, yep, this is a pandemic. Prior corona immunity, nope. If you had one of those other things, no, and colds won't make you immune. The vaccine's unlikely to get past phase 1. We'll see. And even if we wanted to short circuit safety and efficacy, because these things can be dangerous, only the President of the United States can shift it, and there's no guarantee it's going to work. From idea to vaccine usually costs $1 billion in 7 years. I hope we can do it quicker. So there I'm just talking about how it goes. SARS and MERS, we're never able to make one. All families should know that all the viruses, although this virus is dangerous, it's not as dangerous to children. So as of the 27th of February, no child under the age had died. At high risk are people with health conditions such as heart disease. People over 80, it's about 15% mortality. Third world conditions probably would lead to higher mortality, mostly because they don't have the availability of that high level healthcare. But we may not either if we're overwhelmed. The death rate in Korea is about 0.7%, but that's with extensive testing and they could track it down. They probably have a real number, not the 2.5%. On the other hand, they have a pretty high level of healthcare. So I would like to think we could get our death rate down to 1% or below. I'm crossing my fingers. For comparison, influenza death rate is between 0.1 and 0.2. Kind of averages out about 0.15%. So this is many times worse. The assumption is a likely death rate in the US will be less than 1%. I hope so. About 1% of people show no symptoms, and they can spread this virus. So that's why we've got to stop people from moving. Typical is the infected person exposes 2 to 3 other people. Common sense recommendations: tell children, cut the junk food, eat your veggies, you know, it's the normal stuff. Wash your hands frequently and thoroughly, make sure the kids know how. Alcohol for hands is fine, but it's not as good as soap and water. After bathrooming, washing is especially important since the virus is in fecal. Don't touch your face, don't touch your face. You know what, that's really hard for me. I hope I haven't touched my face while I've been talking, because I would set a bad example. But last 2 weeks, I have been just telling myself, oh, that itches, stop. Minimize contact with other people. Gosh, that makes me sad. Avoid gatherings. Well, we've been turning that down. The president was asking for less than 10. Most masks don't work to prevent the wearer from getting this infection. They prevent other people, and unless everybody wears them, it's not really going to work. The healthcare providers need them. The largest concern with children is exposing parents and grandparents. That's the risk. The risk to a child is not zero, however, but it's been very, very small. For professional staff, phone triage. Make sure you call the people before they come in so you know what you're dealing with. And if it's something that's even semi-elective, have them stay home. When they come in, screen upon arrival. That's what we did here. I had to go through the screening as I walked through the door. Aerosols from a cough or sneeze can be a problem for at least half an hour, maybe longer. Consider moving to telemedicine to avoid spread. That is really important. For possible contact with infected individuals, recommend N95 masks if you have to be in there. And you need to have the training for those PPEs. Removal of PPEs was the highest risk of self-contamination in China. I'm sure that's true for us as well. There's a summary article in the Journal of the American Medical Association that you can look at. You can certainly ask me for it. So, comparison of influenza statistics. As you can see, the typical influenza has about 0.15% mortality. And you can see what China did. They just about turned the country off. Now their strategy seems to be working. Now what I'm going to do is go through the Johns Hopkins website, where each day as it stepped along, and sometimes I skipped a couple of days, you can see how this infection is spreading exponentially, and the red is getting bigger and bigger and bigger all the way up to this morning. Stopping transmission. Don't shake hands, hug, or kiss when greeting other people. Wash and scrub your hands and nails with soap and water. Remove your shoes when you come from indoors. Don't take them in the house. Be mindful of touching doorknobs. Be mindful of touching doorknobs. Stay home if you're sick. Cover your mouth and nose with your elbow when you sneeze. Hand sanitizer and antibacterial wipes to clean your hands is not a miracle cure. Wear gloves. Think about it. If you're wearing gloves, keep your hands warm. How are you going to clean those gloves? I think that's an issue. Wear a face mask if you're sick. Well, maybe if your healthcare provider tells you to. Don't touch your face. Don't touch your face. So, I want to ask the chaplains, what do you think? How can we help with youth, business owners, medical staff, people with multiple comorbidities, cancer, autoimmune disease? What can we tell them? Independent elderly. How are we going to modify their behavior? They're independent. Infirm elderly. Vulnerable with developmental delays. You're going to have to talk to their caregivers. How are we going to take care of ourselves? This thing is coming. So what would be my messages? We have to communicate with other people about precautions and protocols. Use your voice and your relationship to affirm, because if you see things that are happening and are not right, we have to be a little more in people's faces, unfortunately. Be mindful of those who rely on an hourly wage. This is going to disrupt their income. Encourage phone checks on those who are most vulnerable. Isolation can become an issue. We have to encourage people to contact elderly or anybody that's isolated. Neighbors should not go out. Investigate online platforms, and that may be useful. I'd like to mention Apollo 13. So you probably all remember the story, how an oxygen tank exploded. And Gene Cernan, or I'm rather not Gene Cernan, but it was Gene Kranz who was there. And the NASA director said, this could be the worst disaster NASA has ever endured. And Gene Kranz said, with all due respect, sir, I believe this is going to be our best hour. Let this be our best hour. So, any questions from our chaplain staff? Yes.
What's the current understanding of contagion rate for people who have recovered from COVID-19?
We don't know. We don't really understand it. You know, people have only recovered for a couple of weeks at best, maybe 3. And so the suspicion is that if they get reinfected, maybe they weren't reinfected, maybe they still had it. So we just flat don't know.
Mm-hmm.
Other questions?
Yeah, actually 2. If a person tests that they don't have it, it doesn't mean that they won't get it or that they've had it, right? What does it? It's just a moment in time.
Right.
I mean, everybody
Right.
wants to go out and be tested like we're well,
but
showing symptoms.
Our experience is that in Korea and other places where people have been tested, and then they've been tested a couple days later, one may be negative, the next one is positive. So they just may not be expressing it yet. Again, a question.
Was, of course, you know, all these rumors are out there, and you mentioned that that China may have actually been surfacing as early as October. Does that mean that we may have already been exposed to it sooner?
Yes. Yes.
My husband had an upper respiratory illness, and he ended up in the emergency room like the end of December, first part of January.
Yeah, we don't know. We don't know because we don't have the tests, and we don't know. Now, maybe we could test for antibodies. We might be able to tell. We don't really know how much is out there. Other questions?
Chaplains go from room to room. Is distancing a way of, is that an option for us to stay 6 feet away, or is it already in the room?
Well, so again, it's a matter of the density of the viral particles and how healthy you are, and whether you're wearing your PPEs properly. Or in the case of people that maybe don't have any symptoms, are we going to wear PPEs? That's a question. So social distancing is going to protect you somewhat via density. We don't think it really comes from just people breathing, but it comes mostly from droplets. So, but if you touch something, I mean, you're going to have to be very scrupulous and highly mindful of what you're doing. And if you're feeling under the weather, protect yourself, because we can't really afford to lose one of you guys.
It's Keith Collins here, Dave, and I'd like to know if there's something we can do to escalate an effort to get involved with meaningful teledentistry. So I understand that there are medical clinics that are doing a lot of telemedicine, and that we could screen patients before they come to our clinics better if we could engage them in a teledentistry conference. And I don't really know of some good things that relate to a standard of care for the things that we can or cannot determine during such an encounter.
You know,
And
a lot of that's going to have to be created, Keith. We don't have, I mean, some places have experimented in their protocols, and I mean, you've provided me with some technology here that helps. But I think it's the right thing to do. We have to maintain contact with people.
yes, well, I would like to invite anyone that wants to participate to work with me and possibly Dr. Carsten, whatever authorities that want to throw some effort at it or resources. But I think now is the time that we really need to not only engage in teledentistry between ourselves and our patients, but dentist to dentist. And we actually need to be doing some interaction with the MDs. So we're talking about medical dental collaboration. Well, one of the easiest ways is to do a live video conference with screen sharing, where we can see somebody's medical record and talk to a medical provider while discussing problems the patient has. So it's obviously more of an issue for somebody that would be a hospital dentistry patient than it is for somebody with a denture sore. But I think this is the right time.
I think so, Keith. I think you can play a big role in that. Are there any other questions? Because I've got a meeting over at OHSU. Thank you very much, everyone. I'm going to be signing off. I'll try to make this available to people within a day or so. Thank you all.
Thank you, David.
Thank you.
Thank you,
Thanks,
David.
Steve. Great job.